For the past about 1 year, I've almost exclusively been using the Cannula Technique to inject most of my fillers. Now, it doesn't mean that I don't use a needle at all. I do need to make the entrance with a needle, but after that, I do inject with what's called a blunt cannula. It has decreased the rates of bruising by almost 90% in my practice, and we have happier patients who can get a treatment at lunchtime and not have to worry about bruising for a week. So I'm going to start injecting Kim with some filler. Now I have topically anesthetized her. I've also put some aliquots of lidocaine anesthetic where I'm going to go in with the cannula. So first what I do is make a little poke with a needle. Did you feel that, Kim?
No.
No. I'm actually going to go in using what's called a blunt cannula. It's just not sharp at the tip. And it may look a little more traumatic than a needle, but it's actually not cutting through any tissues. It just moves tissue out of the way as it goes beneath the skin. How do you describe the sensation, Kim?
I would say it feels like you're just pushing on my skin.
Okay. And the advantage of the cannula is that with one entrance, I can access multiple areas. Now that I've done some in the middle of a face, I can actually go into this canine groove by just changing direction, and I don't have to make a separate hole. As we are injecting fillers deeper and deeper, and we are increasing the likelihood of injecting into big arteries and cutting through vessels, I certainly feel like the cannulas offer me a margin of safety that a traditional sharp needle did not. If you're not cutting through blood vessels as a sharp needle would do, we obviously don't get any bleeding under the skin, and therefore no bruising.